Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is how to non-operatively treat sciatica. Sciatica is pain that occurs in a person's leg due to a pinched nerve, and usually it gets pinched from a herniated disc. The sciatic nerve is actually a conglomeration of several nerve roots that come together after leaving the spine. So you can see here you have L4, L5, and S1 emanating from the lower spine, and these come together and form the sciatic nerve that runs down the back of the leg. If one of the nerve roots is pinched as it's leaving the spine, it causes sciatica with resulting symptoms, usually related to where that nerve root provides sensation and motor function. At any one point in time, 1% of the total population suffers from sciatica. The symptoms are going to depend on which nerve root is being pinched. Most commonly, it's a herniated disc between either L4-5 or L5-S1, the two lowest levels. The nerve being pinched does not cause pain in and of itself. It's the inflammation that's being sparked up that leads to the sciatica pain. And this can be either a burning or a searing pain or a sense of tingling or pins and needles. It can also lead to cramping, numbness, and weakness. The diagnosis of sciatica starts with a history and physical. You can see a doctor here doing what's called a straight leg raise test. You lift up the side that's in pain with the knee straight, and usually that increases the pain because it puts tension on the nerve root. And then when you flex the knee, it usually takes tension off the nerve root and the pain dramatically is relieved. That's very sensitive and specific for a herniated disc. An MRI can be very helpful. For instance, you can see right here there's a large disc herniation coming out of the disc, pushing on the nerve root here. And then if necessary, a nerve conduction study can be performed to see how badly a nerve root is being affected. Now, most L4-5 disc herniations are going to pinch on the L5 nerve root. And when they say dermatomes here, they mean where it usually provides sensation. So L5 usually comes down through the buttock, down the outside of the thigh, and then down on the side. S1 is usually the back of the leg, and down the back and side of the foot. Okay, but most patients don't step right out of a textbook, so it might not be exactly where those symptoms are. All right. As you can see, L5 actually comes a little bit around the front of the foot. Okay. So when you start talking about muscle weakness from sciatica, this does not always occur, but it can. It's more concerning because it shows that the nerve root's being more affected than just from numbness. And it's unclear how long you should watch someone with motor weakness until it becomes irreversible. So it may be that you watch it for a couple months, see if it's getting better. If not, the decision is made to undergo surgery. It may be 3 months, but once you start getting out past 3 months, it's not clear. We don't know actually. If you go ahead and wait for 6 months to do surgery, it might be a technically perfect surgery, but the weakness may never get better. All right, so these are the nerve roots, L2, L3, and then this is what they affect. Hip flexion is L2, L3. Hip adduction, L2, L3, L4, and it goes down the list. All right, so when you start talking about lifting up the foot, dorsiflexion, that's mostly L5. So those are the things to look at. Lifting up the big toe, almost purely L5. So you can kind of tell where the motor weakness is, what nerve roots are being affected. So non-operative treatment for sciatica, there's quite a few options. Over 90 to 95% of patients can be treated non-operatively. This may include over-the-counter medications, anti-inflammatories, and Tylenol, a Medrol dose pack, which is a very high dose of prednisone that tapers off over 5 days, narcotic medications, muscle relaxers can help, neuropathic medications, which may include Neurontin or Lyrica, and then topical pain medications can also be very helpful. Physical therapy and or chiropractic treatment can be very helpful for relieving the pain. Spinal decompression therapy you see here, it actually provides computerized intermittent traction that places negative pressure in the disc and can help relieve the pain of a herniated disc and sciatica. Interventional treatments may include trigger point injections, which are subcutaneous injections and great for spasms and aching. Epidural injections are the gold standard. They have been for over the last 50 years. They may be a series of 3 injections and repeated every 2 to 3 weeks. And basically what happens is the steroid medication is placed at the area where the nerve root's getting pinched, and it provides a soothing anti-inflammatory effect. It doesn't fix the problem, but it can be a great band-aid while the body itself is disintegrating this piece of disc. Dozens of studies have looked at it, and there's a 75 to 90% effectiveness for relieving the pain of sciatica. 80% recover within 6 weeks for sciatica, 90% recover within 6 months. Studies have shown that the outcomes at 1 year with sciatica are identical between operative and non-operative treatment. That was a landmark study back in '06 out of the Journal of the American Medical Associations. Symptoms to watch for: muscle weakness, as we discussed. It's unclear how long you can watch it to see if it's going to get better before it becomes irreversible. Okay, so especially if it's getting worse, the consideration should be made for possibly having surgery. Incontinence, whether bowel or bladder, is a surgical emergency. Never wait on that. You should have surgery within 24 hours when that happens. And then worsening symptoms, as mentioned. If 6 weeks of conservative treatment just does not help at all, then consideration can be given for an elective surgery for the sciatica. The top non-operative pain management in Texas is through the Texas Pain Network affiliated clinics. There's over 50 insurances accepted with over 25 treatment options. The board-certified award-winning doctors average over 90% success rates. Visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.